So as a parent, you need to keep asking a few questions to yourself. What are my child's strengths? What is my child good at? What is their weakness? Where is it that my child is lagging? So what behaviors are causing problems? Most essential part as far as autism is concerned is early intervention. And an early intervention can occur as early as 2 or 3 years of age. Why we say this is, as I told you, diagnosis for autism can be done at the age of 2. So as soon as a diagnosis is done, it's better we start intervention. In a layman's term, in this period, young child's brain is still forming, meaning it's more plastic or changeable than at older age. Because of this plasticity, treatments have a better chance of being more effective in a longer term. Early interventions not only give children the best start possible, but also a good chance of developing to their full potential. The sooner a child gets help, the greater chance for learning and progress. We've also seen that with early intervention, some children with autism make so much of progress that they are no longer on the autism spectrum when they grow older. So when I say early intervention, I mean programs that can help children gain basic skills, physical skills, thinking skills, cognitive skills, social skills, and emotional skills. We need to understand that no two children with autism are same as each other. What works well for one child may not work a bit for another one. Children with autism do not have same strengths and weaknesses as each other. Their IQs do not fall within the specific range. Their ability to handle social situations and understand social cues are different from one another. And they are no way related to their academic abilities. So this is for parents to know. Very, very important is the milestones, developmental milestones, right from the time a child is born. If a parent feels that the child is lagging behind in any of these areas, please consult a psychologist, preferably a clinical psychologist, so that they can give you best advice. Now we come to the main part, that's parenting or raising a child with autism. So no parent is ever prepared to hear that their child is anything other than happy and healthy. And when a parent gets a diagnosis of ASD or autism spectrum disorder, it can be very, very frightening. And many parents are not sure how to help their child, because there are many treatments available, many advices available, and they can be confusing, conflicting also. And what I have seen in my practice is, once parents are told that there is no cure for autism spectrum disorder and this is a lifelong condition, they just leave their child. They do not provide any intervention because they feel nothing is going to make a difference. This is where we are going wrong. They need to consult a clinical psychologist, get a diagnosis done, and start therapy at the earliest. A few parenting tips that I always insist with a child who has autism is be consistent. Why I insist on this is children with autism spectrum disorder have hard time applying what they have learned in one setting to others. Like whatever they learn at the therapy center or school, how to use them in home, it's very, very hard for them. Say, for example, the child uses some word to communicate at school, but the child will never think to do that at home. Creating consistency in your child's environment is the best way to reinforce learning. So find out what is your therapist doing? How is your therapist teaching? What's happening at the school? Find out from the teachers and continue that techniques at home. Next is stick to a schedule. This is very important because a child with autism, they tend to do the best when they have a highly structured schedule or routine. Set up a schedule for your child with regular times for meal, therapy, school, and bedtime. Try to keep disruptions to this routine to a minimum. If there is an unavoidable schedule change, prepare your child for it in advance. Reward good behavior. Positive reinforcement can go a long way with children who have autism. So make an effort to catch them when they're doing something good. Praise them when they act appropriately or they learn a new skill. Being very specific about what behaviors they are being praised for. Create a home safety zone. Make a private space in your home where your child can relax, feel secure, and be safe. This may involve organizing or setting boundaries in ways your child can understand. Visual cues can be helpful. You could use a colored tape marking areas that are off limits, labeling items in the house with pictures. Very important point is look for non-verbal cues. Be very observant and aware and learn to pick up the non-verbal cues. Usually, a child with autism use some non-verbal cues to communicate. So when I say non-verbal cues, I mean the sounds that they make, or try understanding their facial expressions or gestures usually they make when they are tired, hungry, or want something. Another very, very important thing is figure out the reason for tantrum. It is very, very natural to feel upset when you are misunderstood or ignored. And it is no different from children with autism. When a child with autism acts out, it is often because you as a parent are not able to pick up their non-verbal cues. Throwing a tantrum is their way of communicating their frustration and getting your attention. Another very important thing is paying attention to your child's sensory sensitivities. Many children with ASD or autism spectrum disorder are hypersensitive to light, sound, touch, taste, and smell. Some children with autism are undersensitive to sensory stimuli. Figure out what sights, sounds, smells, movements, and tactile sensations trigger your child's bad or disruptive behaviors, and what elicits a positive response. What things make your child stressful? What are the things help your child to calm down? What are the things that make your child uncomfortable? What are the things that your child enjoys? Try finding out that. So, as a parent, you need to keep asking a few questions to yourself. What are my child's strengths? What is my child good at? What is their weakness? Where is it that my child is lagging? So, what behaviors are causing problems? What is the skill that my child is lagging behind? How does my child learn the best? Is it through seeing, listening, or doing? What does my child enjoy? And how can those activities be used in treatment and in helping my child learn better? So, some of evidence-based therapies that we suggest or I suggest for parents are behavior therapy to manage their disruptive behaviors, speech and language therapy, because we see that these children lack speech, or there are delays in speech, or they're not able to speak at all. Physical therapies or occupational therapies, here usually because there could be some movement, repetitive movements, the child could be hypersensitive to various sensory issues, or they could be hyposensitive to various stimulus. Then social skill training and emotional regulations also. But as a parent, please keep in mind that no matter what treatment plan is chosen, your involvement is vital for success. You can help your child get most out of the treatment by working hand in hand with treatment team and following through with the therapy at home. So I have been associated with an organization called Cognitive Cortex, wherein we are developing an artificial intelligence for autism intervention, which we call as AI for AI, wherein we are trying to integrate these therapies like behavior therapy, speech therapy, occupational therapy, and social and emotional skills training. We are developing a software wherein a child can learn through these therapies, these skills, so that not even a single child, even in the remotest corners of the country, is left unattended to. This particular software is not a replacement for the therapist. It is just to help the parents help their child in a better way.